Good afternoon and welcome to our Oak Bend Medical Center Happy Hour podcast. My name is Donna and I am your host. Today we welcome back Dr. Larry Ladi. Dr. Ladi, here at Oak Bend Medical Center, we know him as our emergency room physician, but he does so much more. He is fellow trained in sleep medicine. He is critical care interventional pulmonology certified internal medicine. When we talk about sleep medicine physicians, such as Dr. Ladi, they are trained to treat many different conditions, including insomnia, narcolepsy, sleep apnea, idiopathic hypersomnia, and circadian rhythm disturbances, among some. Welcome back, Dr. Ladi.
It's always a pleasure to be back with you.
We've been hearing about COVID and everything else, but the one thing we know that we're seeing a lot of people not taking care of themselves, and they're ending up getting in trouble and coming into the emergency room really, really sick. So one of those things we wanted to talk about today is, what is sleep apnea?
So sleep apnea, it's actually a syndrome more than anything else. It's a syndrome of obstructive sleep. So you have when you're sleeping and your airway gets blocked while you're sleeping because of multiple factors, either anatomical factors, genetic factors, medications. So there's multiple factors that can cause for you to have sleep apnea. Obstructive sleep apnea specifically is when your airway collapses when you're sleeping at night. Even in our current time now, and granted, over the past year, COVID took over the stage when it comes to medicine and healthcare. Sleep apnea has barely made it to the mainstream, medical mainstream, where people are more apt to being diagnosed with sleep apnea. And in fact, because it's not well known or not well sought out, people tend to get underdiagnosed and not diagnosed with sleep apnea.
But yet, sleep apnea can contribute to a lot of major illnesses.
Correct. A slew of illnesses. You know, it's interesting enough as we talk about all these other pathologies in medicine, and in sleep, we literally spend a good portion of our life in sleep. Let's say in the average, we spend about 25%, 30% of our life in sleep. Stuff happens when you sleep. There's physiological changes. There's changes in hormone levels. There's changes in oxygen levels. Sleep plays a significant role in the stress the body endures. So, for example, immune response. Your immunity gets better when you sleep. There are certain immunoglobulins that get released or activated while you sleep. So whenever you have any type of, or anything that inhibits your sleep or causes any type of disarray in your sleep, that will then cause problems with everything else downstream, meaning your immune system, the way your body copes, such as who have significant sleep apnea tend to have elevated blood pressures. These are just some examples of how uncontrolled sleep apnea affects the body.
Okay, so I was talking to some other people and telling them we were going to be doing this podcast on sleep apnea.
Yeah.
And you mostly think of somebody that snores, overweight, that kind of thing. But you really don't think it's that serious. And then I was kind of looking, why is it that men are more prevalent to sleep apnea than women?
So that's a very, men are actually 3 times more likely to have sleep apnea. 3 times more likely. Women, and interesting enough, so for men, it's the physical attributes that we have in our airway. And as you get older, certain aspects of your airway tend to become more lax, causing you to have sleep apnea. A lot of it's the anatomy, the way our neck is built, the way our chest is built, or causes sleep apnea. Now, with women, you'll be surprised that actually in particular, women tend to be, if you look at usually men who gain weight, they tend to have more of a prevalence of sleep apnea than non-obese men. But interesting enough, sleep apnea in women happens to be in postmenopausal women who are not necessarily always obese. Okay, and hormones play a big role in them having sleep apnea. So, for example, a recent study was published back in 2012. It looked at the prevalence of sleep apnea among women over the age of 40 or postmenopausal women. And they found that actually the prevalence of sleep apnea is much similar to that in women after the age of 40, or in women who are postmenopausal. So even though women tend to have less sleep apnea at a younger age, let's say if you compare the 20 to 30 demographics, as they get older, as they become postmenopausal, then the prevalence of sleep apnea among women is almost equal to that of men.
So how does polycystic ovary disease contribute to sleep apnea?
It could. So it could because of polycystic ovarian syndrome causes a significant amount of hormonal changes in the body, but also there's an obesity aspect of it as well. Not always the case, but there is. But that can play a role in sleep apnea. Or the other aspect you have to understand is, did the person have obstructive sleep apnea prior to being diagnosed with polycystic ovarian syndrome?
So how would I know if I had sleep apnea?
But you wake up and you still feel like you haven't slept any, and you're sleepy throughout the day, you're yawning, 2:00 in the afternoon, you want to grab that coffee because you're feeling very sleepy, or you're falling asleep at work, you're falling asleep in front of the computer. These are indicators for us that you're having some type of sleep issue during the night.
Okay, and I guess now with all the iWatches and the sleep apps and everything, there's a good indicator there as well.
Restlessness sometimes, yes. And your sleep partner will tell you, hey, you're snoring a lot. Not everyone that snores has sleep apnea. However, snoring is caused by a laxity in our hypopharynx. And when that happens, a lot of times snoring is an early indicator of obstructive sleep apnea. Sometimes what happens is people stop breathing in general. It's kind of scary. And that is also an indicator of obstructive sleep apnea.
Okay. So let's say I have these symptoms. I go to my doctor. What happens next?
So your doctor, if they determine that you have sleep apnea or you have symptoms consistent with sleep apnea or obstructive sleep apnea, you can actually take a overnight polysomnogram exam. And what that basically does is you go to sleep at a sleep center. Now they even have the home studies that monitors your oxygen levels, brain waves, and see what stages of sleep you are. And it also looks at your oxygen movement of air and your oxygen levels. That indicates whether or not.
Now I'm going to go to the doctor. What do I tell my doctor, and what happens next?
Yeah, so you can tell your doctor, you're having restless sleep, or you don't feel like you're waking up in the morning. You're not feeling like you've gotten your full sleep, your full energy. You still feel tired. You still feel fatigued. You're requiring supplementation of caffeine to actually get through the day. You're snoring at night, or you wake up multiple times during the night. These are issues that can, over the course of months or years, can cause significant havoc to your body. And that's something you need to talk to your doctor about and say, is there a possibility to have sleep apnea? If your bed partner says you're snoring a lot or you stop breathing while you're sleeping, those are other clinical factors that you won't know, but your bed partner will know that you have symptoms or signs of sleep apnea.
It feels like it's something no one really wants to admit, that they have a problem with sleeping or possible sleep apnea. I know the guys that drive trucks now have to take sleep studies if they meet certain criteria. But it's not something that I see generally that we've adopted to really push forward on, like you said in your earlier comments. I do have a question, though. I know that it has to do with white matter in the brain, and it decreases with sleep apnea, right? Is there a correlation with Alzheimer's and sleep apnea?
So Alzheimer's plays a significant role. So any type of neurological disorder will cause when we look at sleep architecture, and it affects the sleep architecture. Many times, and something called parasomnias. People have these acting out episodes that usually indicates an early sign of neurological degenerative disorder, such as Alzheimer's. So yes, these are kind of sometimes early signs of a sleep disorder. Not necessarily sleep apnea per se itself, but an early sign of a sleep-related disorder. So, such as parasomnias, and you mentioned parasomnias on the introduction, and that's where people act out sometimes in their sleep, and don't remember that they acted out.
Okay. Mm-hmm. And is that something similar to sleepwalking?
Sleep is something like sleepwalking, right? Mm-hmm.
Okay. So I do understand that statistics say 1 out of 5 people over the age of 65 have sleep apnea. So evidently, as we age, it becomes more prominent.
As we age, it becomes more of a anatomical issue for us. Unfortunately, collagen and certain parts of your body tend to become more lax rather than tight. And that in sleep apnea, and I think the biggest important thing is to understand what is sleep apnea. Sleep apnea is a narrowing of the airway or a blockage of the airway when you fall asleep. It can happen with your tongue falling back, so people tend to have more symptoms of sleep apnea when they lay on their back. But if you already have a very small airway opening, and as you get older, the back of the oral pharynx tends to become more lax, tends to hang a little more. As you age, because collagen tends to become more lax, that tends to cause the obstruction why we see such a prevalence in populations that are usually greater than 50. Mm-hmm.
Okay, so we go to the doctor, we have the sleep study, and I have sleep apnea. What's the fix? Is it a pill?
No. So really, if you have obstructive sleep apnea, depending on the severity of your sleep apnea, and usually if you have moderate to severe sleep apnea, you'll be prescribed something called a CPAP what that does is it's a device that actually blows air or pressurized air into your airway when you're sleeping and pneumatically opens your airway and wedges it. So when you fall asleep, your airway doesn't collapse, but rather stays open. And it keeps it wedged while you're sleeping at night. During the daytime, those certain muscles, because depending on what stage of sleep you fall, depending on the stage of sleep, is usually when your sleep apnea occurs. And when that happens, you have a laxity of your muscles, okay? And the muscle collapse. When you're awake, those muscles are tightened and they don't collapse when you're awake. But when you fall asleep, they do. By having the positive pressure machine, such as a CPAP device, what that does is actually pneumatically wedges your airway and keeps it open. So when you fall asleep, your airway doesn't fully collapse.
So it seems like we ought to be testing for this, or requesting to be tested for this a little bit more than what you're seeing.
It's a public health issue. Obstructive sleep apnea is a huge public health issue. It affects productivity at work. Now we have truck drivers required to, if they meet the criteria, to be tested for sleep apnea. But what happened in the years prior to commercial motor vehicle drivers? Before this was a requirement. We're actually now, I always knew about it, but I mean, now the mainstream medical field is actually realizing the importance of sleep apnea and the treatment of sleep apnea. Non-treated or untreated sleep apnea has on the rest of the body, such as blood pressure, diabetes management, quality of life. Mm-hmm.
And I understand it can even be memory loss and depression. It affects your diabetes, heart attack, stroke, and even possibly an early death.
Yes.
If it's severe enough.
If you have severe enough sleep apnea, your oxygen levels drop significantly. And if you add that as a cumulative over the course of many years, you develop significant degrees of strain on the heart from not having enough oxygen. And yes, death can occur.
Can it be cured?
I think so it was interesting enough when I did my training, that was a question that I asked as well. Well, can't you just do surgery and make someone better? interesting thing is that they actually looked at people who had severe sleep apnea, and they did oral surgery to open the airway to make it bigger. They did tongue resection surgeries, so the airways open when they fall asleep. And what they found was that even after the surgery, people still required to use a CPAP or some type of positive pressure ventilation device. So really, it's more of a treatment rather than a cure. There's no cure to it, but there's a mechanisms of treating it. Anatomy plays a big role. Obesity tends to play a role, but obesity is not a sole reason of sleep apnea. Sometimes it's just the anatomy. People who have small chins, or chins we call retrognathia, which is like a chin that's kind of pulled backwards. If you ever see people whose chin is kind of more in reverse, those individuals tend to have an anatomical reason. They can be skinny, but they have an anatomical reason to have sleep apnea.
Dr. Ladi, do you have any more advice or information that you'd like us to know in regards to anything, but especially with sleep apnea and sleep deprivation? Because it seems like it can cause a lot of problems that we could prevent if we caught this early enough.
I think it's important for the general public to see that if they're feeling sleepy, they have family members that are feeling sleepy. It's not a normal sign of aging. It's not a normal sign of being at work. This is a chronic condition. Talk to your primary care provider. Tell them you're not sleeping well, or you're sleeping the whole day, you sleep the whole night, but you still don't feel fully refreshed. These are signs, these are symptoms that need to be addressed with your primary care provider, who'll be able to identify whether or not you are somebody who might have obstructive sleep apnea and need to have further testing.
Okay, I really want our community to know. I've heard from truck drivers and others, well, it's just a moneymaker. It is not just a moneymaker. It's real. And we need to take care of ourselves so that we can prevent future things from happening.
This is an actual problem that we have, and it's an actual medical problem, and it's not a moneymaker. It's something that needs to be addressed, just like heart disease is. And with sleep apnea, a lot of times it can be a sequelae or a part or a treatment to the heart disease that the person has as well.
Okay. Dr. Ladi, I wanted to thank you for joining us again today and look forward to having you back on different subjects. And a big thank you to our listeners for tuning in. Beginning now, set an intention and a relentless focus on living your life as the greatest person you can be in all situations. Please join us next week.
Thank you for joining us today on Oak Bend Medical Center Happy Hour podcast. We hope you enjoyed today's broadcast and invite you to email us at oakbendhappyhourpodcast@obmc.org with any questions or topics that you would like for us to cover. Remember, you can find us here each Friday at 5. Until next week, be mindful and stay healthy.